Atopic dermatitis clinical case. Atopic is an inherited condition that predisposes to suffer from a number of diseases mostly related to eye median alteration of cellular immunity and vascular reactivity. Atopic dermatitis is a set of anomalous and skin lesions that appear in atopic individuals. Etiology. Atopic dermatitis is an cutaneous manifestation of Atopia that is willingness of people to suffer from hemoglobin E. The mechanism involved is complex. It is an immune cells called cells and mast cells. When the patient's immune system detects any of substance that cause allergies or certain infection.
Hi, I'm here to share with you on atopic dermatitis.
The skin may be very swollen and red. Erosion or
Atopic dermatitis is a chronic skin disease. The causes are not fully understood, but one suspects a combination of immunological changes, environmental influences, and genetic factors.
It is an incurable
Since any person can discern the disease is individual, mutation analysis is virtually impossible.
Corticosteroids.
Infants and young children often suffered from cradle cap on the head.
Systems therapeutic.
That which all patients have in common is an impaired barrier function of the skin. To trigger the episodic itching, sometimes enough already the wrong clothes, the constant itching and scratching, the skin is further burdened and thickens with age. Creams and further care products should counteract the scaly, red eczema. They are available in the pharmacy and the same water loss from the skin. But a dermatologist must visit in any case. Besides the medicines, you have to also change your clothes. Many textiles are loaded with dyes or fabric softeners and come from low-wage countries where the European regulations and approvals for dyes or chemicals do not apply.
Of 3.750 grams. Who was fed exclusively red fats until the 6th month of life is presented in addition to addition suitable according to the same scheme established by the National Public Health System. The first years of life passed without associated conditions. From this age began to show itching, not with the usual intestine, and at 2 years of age, worsened appeared erythematose and papuloscomus lesions in popliteal and antecubital, very itch folds which made it hard to sleep. doctor prescribed a different drug had Mont Lucas and for his 8 weeks. However, it did not show improvements, so that indicate him hiccups. There was some improvement, but the picture worsened by the climate change. Present bronchial IU. General care. Cut nails, bathroom with a warm bath gel. Do not use soap.
Rash, what to do if you see signs of infection, and when to call your healthcare provider. Your action plan is divided into green, yellow, and red zones. The green zone means you're doing well and your skin is clear. What can you do to keep your skin clear? Your action plan will tell you. You should take a 10 to 15 minute bath or shower once a day. Use cleansers and shampoos for sensitive skin and use them at the end of the bath. Apply the moisturizer within 3 minutes of getting out of the bath and when you feel itchy. Remember not to scratch and keep your fingernails short. Avoid your known triggers and irritants. In the yellow zone, you have a mild rash and itching. Your action plan will tell you what to add to your skincare routine. You will still take a bath at least once a day. Your healthcare provider will tell you which topical medicines to use after the bath, probably twice a day. This goes on the red, itchy, rashy areas. You will still use moisturizers frequently. Remember not to lay your moisturizers over medicines. You may need to take oral medicines in the daytime and at night for itching. When in the red zone, you are experiencing severe rash and itching. Again, your action plan will tell you what to do when this happens. You should try to increase your baths and moisturizers to 2 to 3 times a day. Your topical medicines may change. You may need more oral medications for itching. Watch for signs of infection, which are increased redness, pus-filled bumps or oozing, cold sores, or fever blisters. Call your healthcare provider when you are in your red zone or if you think you may have an infection. Part of your action plan can remind you of all the other things you can do
The reason why our patients have this disease is an area of active research. There are two leading hypotheses or theories. One is called the outside-in hypothesis. The other one is the inside-out hypothesis. So you can see this is a sort of chicken or egg sort of discussion. In the hypothesis, researchers believe that immune system abnormalities lead to that damaged skin barrier. We've come to recognize that about half of our patients with more moderate severe persistent atopic dermatitis are missing a key building block protein
explain what eczema is, and in a subsequent episode talk about how to treat eczema. The word eczema is a very, very confusing term, and the reason that it is because on the one hand it refers to a very specific disease, and on the other hand so many people use the word eczema improperly in referring to diseases and conditions that are either persistent or recurrent. Let's talk about the real word eczema. Eczema refers to a disease called atopic dermatitis. Atopic dermatitis is a rash that tends to be hereditary and run in families. It usually is in infancy or early childhood, and it's very often associated with two other diseases, with allergic rhinitis, which is called hay fever, and also with asthma. And that association may not be in the same patient, it may just be all three or some of those run in the same family. Atopic dermatitis, again, usually starts in infancy, and when it does in an infant, it's usually on an extensor surface, like the back of the arm or the front of the leg or thigh, and sometimes on the side of the neck. By early childhood, it's changed to flexor surfaces, the front of the elbow, behind the knee, and again, still on the sides of the neck. You get the rash, It's usually very, very itchy, so it causes a lot of scratching. And the skin turns red, and there are a lot of bumps. But that's the technical and proper term of the word eczema. But so many people refer to so many other rashes, again, are recurrent or persistent with the word. And what they do is they take technical names and just add the word eczema after it. So dandruff is really called seborrheic dermatitis. But some people call that rash when it's on your face seborrheic eczema. There's a form of a rash that you get no oil in your skin. That's called asteatotic dermatitis. Asteatosis means a lack of oil. So asteatotic dermatitis is from no oil and you get a rash. But a lot of people call that asteatotic eczema. When people get chronic rashes on their hands, instead of calling it hand dermatitis, they call it hand eczema. So this is why the word eczema, when used inappropriately, creates so much confusion. But when a dermatologist says the word eczema, he's speaking about atopic dermatitis. He's speaking about that hereditary skin condition starting in early childhood, often associated with asthma or hay fever. He's not talking about those other broad categories.